Welcome to my page, please. I will be discussing on a very important issue as cervical cancer. While having regards to the fact that there's an increased incidence of cancer, it becomes of the wholesome meaning for us to discuss other alternative methods or smaller methods that can be employed in the management of cervical cancer. First, the common methods for management is, however, surgery, then chemotherapy, radiotherapy, immunotherapy. There are some other methods that can be employed, however, to manage cancer or vis-a-vis to prevent cervical cancer. Now, but the first thing is that it is important to look at some of those risk factors and also etiological agent of cervical cancer. What are the etiological agents or risk factors? Some behaviors we can put up, some abnormal behaviors that can increase the risk of cervical cancer. One, the primary culprit incriminated in cervical carcinogenesis is, however, human papilloma virus. Human papilloma virus is a virus that is highly incriminated in cervical carcinogenesis. The subtype of 16 and 18, that's the variant of the human papilloma virus, these are the type that are, however, implicated in cervical carcinogenesis. But how do we get this cervical cancer? Well, it arises from long-standing infection, yes. Long-standing infections from the human papilloma virus, sexually transmitted, however, yes. Once it is sexually transmitted and the person has been exposed for a long period of incubation and the virus has not sustained itself, there is high tendency that it will change the DNA orientation, and at the end of the day, we'll have the person will come down with cervical cancer. Is it only human papilloma virus that can cause cervical cancer? Is it only human papilloma virus oncogenic? No. We have other viruses, for example, herpes virus. Herpes virus is also one of those viruses that can cause cervical cancer. But how do you get this virus, whether herpes or human papilloma virus? One, it is it is assumed that once you don't keep up to one sexual partners, you stand a higher risk of coming down with a human papilloma virus infection. So people that keep multiple sex partners, it stands as a greater risk of coming down with human papilloma virus. And once you come down with human papilloma virus, the chances are that the human papilloma virus will, however, affect or probably affect the DNA or procure injury on the DNA. And that's where the problem comes, because the DNA is what, however, controls the cell cycle. So, and once the DNA is injured and the repair for the DNA has also been hampered, then cervical cancer comes in. Then chlamydia infection is another long-standing infection. Chlamydia infection can also cause cervical cancer. These are basically the etiological agents of cervical cancer. We need to discuss this before we go into probably some basic management of cancer, and specifically cervical cancer. Let's look at the risk factors first. If we are saying risk factors, what I'm talking about is some of those behaviors we can put in place inadvertently or deliberately that will increase the risk of cervical cancer. One of those behaviors we can always put in place, we may not know, I say inadvertently, because sometimes we are ignorant of our behavior without knowing the implication or the long-lasting implication of our behavior is, for example, smoking. Smoking is highly incriminated as a risk factor for cervical cancer. If I say cervical cancer, for the layman, we're talking about cancer of the cervix. Cervix is part of the female genital tract. That is the neck of the uterus. You can, once the vagina is exposed, you can see the cervix right from the vagina, and then it now joins with the body of the uterus. Now, I said smoking is one of those primary risk factors for cervical cancerogenesis. Now, how does smoking cause cervical cancer? Smoking can affect or dampen the immune system. The efficacy of the immune system will be reduced, and also it can procure damage to the DNA. So, with this effect, either acting singly or in combinations, can help to procure cervical cancer. Then there are other risk factors too that can also cause cervical cancer. The use of birth control pills, yes. Many times you see women after active sexual life, in the event of wanting to prevent pregnancy, they go ahead and start using birth control pills. Studies have, however, found out that the use of birth control pills is a primary risk factor that can cause cervical cancer. And apart from birth control pills, what other risk factors that we can put in place, that can be established here as to some of those behaviors that can, however, procure cervical cancer without the person even knowing? Yes. Now, again, we can look at things that are primary. Mothers that were treated with that testosterone. The daughter of that woman, the mother herself may not come down with cervical cancer, but the offspring that will hit her to be a female will come down with cervical. It's not only cervical cancer; it can come down with cancer of the female genital tract. However, yes, people that were treated in that light. Then there are so many risk factors that can also poor diet, immune suppression. If you have an immune suppression can arise from various circumstances, from different conditions. It's not only HIV condition. We know that vis-a-vis human papilloma, immunodeficiency virus HIV. Because what it does is to ensure that there's immune suppression. So once that is established, there's a high risk of establishing cervical cancer. But there are other conditions that can, however, also ensure immune suppression. But one thing, if you're on your antiretroviral drugs, the ARV drugs, you have your immunity raised. We're talking about those that are running away, shying away from assessing treatment of ARV drugs. So they stand a higher risk of coming down with cervical cancer. There are so many risk factors. Some behavior will put up inadvertently without even knowing. The overall effects of our actions that will lead towards cervical cancer. Now, why are we discovering? It is important for us to know what cancer is. Because cancer is supposed to be is the most deadliest of all diseases. Because the function of the cell is to ensure that there is normal life. There is a physiological mechanism, biochemical, and the anatomic structure of it will be working very fine. But once the cells, the primary function of the cells have been compromised, all of these things, there will be a challenge. And if there's a challenge, then it will no longer be compatible with life. And one thing about cervical cancer is that it's important that at least as a girl child who may have been exposed to anti-sexual life for not less than 10 years, should always go for screening. It's important, at least to check whether there are conditions, pre-malignant precursor lesions, That is, these are lesions that could, however, lead to cervical cancer. So even all females at any given age, it's important too that they should avail themselves for screening relatively time to time to check. We are not just saying, oh, there's a cervical cancer here. Because we're always involved in active sexual life, it's important that they avail themselves for screening, pap smear screening, or besides, apart from pap smear, we can do an antigen test for human papillomavirus to establish whether or not there's a virus. The virus is the primary culprit implicated in cervical carcinogenesis. So with an antigen test on HPV, that's human papillomavirus, if it is rest assured that the person has no HPV, of course, we now believe at least to such neighbor extent 90% that the person may not have cervical. But I said a while ago, it's not only HPV that can cause cervical cancer. I talked about that's herpes simplex virus, and also HIV virus, and other immune suppressive conditions. So, but the most primary culprit is the human papilloma virus. Now, for a girl child, it is important, before we even go into the details, but where we are going to this, probably at least some certain things we need to do to prevent even the occurrence, and also when it has occurred, certain things we can also employ to help ourselves. Now, as a girl child, when you have a girl child of between 8 to 11 years, they will not be exposed to active sexual life. It's important that they are exposed to vaccines to prevent cervical cancers. Yes. A girl child between 8 to 11 years should be vaccinated against the dreaded disease scourge. Importantly, even if you are an adult, it is also important that you go for screening. If you want to go for the vaccination, the first thing is that you need to go for screening. Do a pap smear screening, do an antigen test, like that's the human papillomavirus antigen test, to ensure that you are completely free. If you are not free, then you are qualified to go for the vaccinations. So the vaccines, children are usually exposed to this kind of vaccination. Children between the ages of 8 to 11 years. I'm talking about females, yes, girls. Now, having said that, it is important for us to know that why this screening is important, because we need to first of all find out whether there is dysplastic conditions, whether the normal orientation of the cells have changed, however. So, and also whether there are pre-malignant precursor lesions, pre-malignant that things that lead to cervical cancer, so that you can however go for treatment. You can however go for treatment, then you go for treatment to prevent the occurrence of cervical carcinogenesis. So it means that it is primary on a girl child or an adult lady that is exposed to active sexual life to always come for pap smear screening, and also to do an antigen test, that is human papillomavirus antigen test, to be sure that there is no such thing. The essence is that once it is established there are no pre-malignant precursor lesions, then the lady can go for vaccination. But if there are pre-malignant precursor lesions, you cannot make the attending physicians to carry out this treatment that will, however, prevent anything cervical cancer from occurring. Now, that is for that. Then again, but when cervical cancer has now occurred, we know that the established management pattern is usually surgery, chemotherapy, radiotherapy, and also immunotherapy. First thing about surgery, the organ, they can be total hysterectomy to prevent especially when it has not started spreading. The process that is called metastasis. So there has to be a total hysterectomy. The organ will be removed, and other associated organs, the female genital tract organs will be removed, except the lower part. The lower part has to do with the vagina and the vulva. So it has to be removed. Having done that, the person is exposed to radiotherapy and chemotherapy for specific management. And then still depending on the stage, because the cervical cancer and the diagnosis has to be staged, the level of spread and other things. Then the pre-malignant precursor lesion will also have to be staged. Is it CNA grade 1 or low grade C, high grade C, as the case may be? Then otherwise, before the treatment patterns will be elucidated. Now, these are the natural treatment, this treatment pattern we have in our contemporary times now that is employed in the management of cervical cancer. It is not only for cervical cancer, all cancers are managed in that wise. Yes. These 4 primary methods are employed in the management of cancer. But the emphasis now is that how do we now prevent this from occurring? For one not to suffer cancer, the only way that one cannot suffer cancer is for you not to be born. Yes, that's the only way that one cannot suffer cancer. Let me just show us some of the basic slides. If we go for a PassMed screen, some of the basic slides that we can at least some of the basic slides here for PassMed that we prepare here. I'm sure you can see those slides. Those are some of the slides. They are prepared histologically and using histological methods or cytological methods, as the case may be, when we are looking at cervical cancer issues. The reason for this is that many people suffer from this dreaded disease. And the pain, the financial cost is also a burden. Apart from the financial cost, the implication and everything, especially when it has become full-blown, when it has started spreading, it spreads through blood channels and through lymphatics. It spreads. That's what it does. Now, what are other methods you can employ in helping yourself? Or probably helping someone who is very close to you. If you are a man, you've got 3, at least about 5 women in your life. It's important you get to know. If you are a lady, you are directly affected. What I mean by 5 ladies in your life, as a man, the first woman in your life is your mom. Second woman in your life is your wife. The third woman in your life is your daughter. The fourth woman in your life is your sister. And the fifth woman in your life is your friend, female friend. So this issue of cervical cancer is not just only, we are not specific on females, because then sympathy also has to come. You as a man who have a doctor, and you have all these 5 women around you. So the reason why it is important for us to know proper management and what to do. Now, we are coming now to the main thing on how to, however, using natural environment and circumstances to see how we can prevent cervical cancer. Now, vis-a-vis, so that if we still at the elementary stage, we can employ some specific methods to ensure that cancer of the cervix is eradicated. You know, sometimes I begin to wonder, have you asked yourself, how do animals in the wild survive? Why are they not plagued by some of, even if they are plagued by these dreaded diseases? Have you asked yourself, oh, the vet is not there, nobody's there, the wildlife scientist is not there, the animal science may not be there. They are able to at least get back on their feet and be strong and be human, because we're exposed to all kinds of synthetic analogs and the long run. And once we are playing with a particular disease, before you know it, we're already down. Have you also asked yourself, some of those animals in the aquatic habitat, oh, like the whales, the blue whale, the sperm whale, yes, and all the various, the sharks, the dolphins, the killer whale, all of those things, the fishes in the ocean, how do they manage their ailments? Or you think they are animals? How do they manage their? They don't need human influence or whatever. Before the study of fishery and other things, they were there before. So if the animals in the wild and animals in the aquatic habitat are able to come back to ensure that their health is optimal, so the things that is also very important for us to know that some of the things we need to put in place as a human person that will guide us, at least prevent, eliminate, so that we can have our longevity will be much higher. And before I go into that, of course, in various books we'll be told that people live beyond 100 years before, 900 years, 800 years. How? That's because we're closer to nature. Because most of these medicaments, they are in plants around you. The soil, the water. Water is therapeutic. There's nothing around you that does not have some therapeutic implication, depends on the usage. So but we have run away from nature. To that end, we are plagued by viruses, and at the end of the day, cancer. Now, let's begin to also now look at, let's begin to go into specific details of some of the things we can do. First, you must change your lifestyle, your dietary orientation, your social lifestyle. Yes, if you must escape this dreaded disease, because I said a while ago that the only way that you can escape cancer is that you were never born. In as much as you are born, the chances are very high to come down with cancer. Look at it. Look at this place. Look at this place. We've got chemicals. We've got everything. We're exposed to daily chemicals. We're exposed to so many things all the time. The air is not pure, so we don't live in the same heaven. To that end, the chances of one coming down with things that can change the orientation of the cells, and that's what cancer is. You change the orientation, the supposedly orientation, the performance ratio, what the cell ought to achieve is changed. The way you're supposed to have 1,000 cells, you now have 10,000 cells population, and these are normal cells, redirecting the functions of the supposedly function of those cells. So the best way to at least to ensure that we achieve a healthy lifestyle is to also go back to nature. We must outweigh some of those behaviors like smoking, and the use of contraceptives and other things, so that at least we'll be at a better position to ensure that we live and have a healthy lifestyle. Your dietary regimen should be okay. Now, these are some of the things that you need to start consuming, either in form of drugs or medication or in form of food. There are numerous, however, but I will start listing them. Consumption of pawpaw leaf, pawpaw seed, but it must be stated here that the white part of the pawpaw seed, the white part of pawpaw seed is thought to even encourage cancer formation, but the black part. But one thing about the pawpaw seed is that the pawpaw seed does not only, it's not only helping in cancer management, but also it's hypoglycemic in nature. It's also an immune booster, also an antioxidant. Yes, it's an immune booster. Yes. is also a powerful antioxidant that will help to release free radicals from the body. But these are not taken singly, they are taken in combinations. Okay, pawpaw seed. We also talk about echinacea. Echinacea is another vegetarian remedy that can be employed. Now, you gather various kinds of herbs. Garlic, then the allium sativa gets onions, big size onions. Then ginger will also be there. Broccoli, you have broccoli. Then we'll talk about aloe vera. Then you have grape. You have lemon citrus fruit. When I'm talking about lemon citrus fruit, I'm talking about the big size. Grape, the big size. Kola nuts will also be there. Kola nuts, very large size of kola nuts. But these are plants that have been used judiciously and they have actually worked well. Then almond will also be there. Almond is very, very important. Broccoli is important. Then alfalfa. Alfalfa is another, because they all have their specific function. What this one does may not be what the other one does. Then how do you use them? If you have, for example, maybe you've gotten about 5 to 8 grape citrus fruits, 5 to 8 lemon citrus fruits. Then you have bunch of about 5 bunch of kola nuts. You gather them in bulk. All of these things are brought together. The only thing you need to do in the circumstances is that one, you only wash. You wash, for example, the grape, the fruit. You only wash them. You don't peel them. You don't peel them. You only wash them. Every other combinations you are going to, you only wash. You don't peel. Then you get a very clean blender. Getting a very clean blender. You blend everything, the seed, the bark of those fruits or those vegetarian remedies you have gathered together. You blend them. When you blend them, what are you going to do with them? You sun dry. If you don't have sun dry, you can put it in an oven. You put it in an oven like this. That's an oven where that lady is pointed. Yes. You put it in an oven with a selected low temperature. Yes. Let it dry. Once it gets dry, and by dry, it also sterilizes each other some contaminants at the end of the day. So once this is done, you'll be able to achieve relatively the pattern form of all of these remedies. Then the next thing is how to quantitative to know the at least specific dosage. They are food on their own, however. So at least if you take a teaspoon twice daily, it will help. While you also change your other orientation, your social habits, and every other abnormal habit that will have encouraged cervical cancer. If you keep doing it, this one is important when the cancer has been established. But the cancer has not been established. You can put these things. Consumption of vegetables, yes. Consumption of these things continually while you abstain from some abnormal sexual behavior. You don't start keeping multiple sexual partners. So these are some of the behaviors we need to put up to ensure that we have a healthy lifestyle. At the end of the day, so that the service will not be played with cancer. So that is the story here. And if you find this topic interesting, you can always you can share this video to as many friends as possible. And You can reach me on WhatsApp or on my email. Yeah, reach me on my WhatsApp and my email. Share it, continue to share it. Share it to Facebook, share it to all social medias. Yeah, reach me, then we can take it on. Yeah. Thank you very much, and God bless.